When you think about all these policies and procedures, what's the bottom line when we're trying to implement them? Remember I said the development and the implementation. The implementation has to be done by the medical professional, the boots on the ground at the particular school. It's going to be the athletic trainer, okay? We don't want the athletic director doing it. We don't want the coach doing it. If we're going to implement an emergency action plan policies and AED policy and a coaching education policy and a cool first transport second, or all these different things to save lives in sport, it's going to be a state licensed medical professional. In most cases, it's going to be the athletic trainer. So you probably ask yourself, some speakers today have already spoken about the presence of athletic trainers. Well, we've had the unique opportunity where I work at the Corey Stringer Institute we have actually called, if you can imagine this, we have called every single high school in America, not a random population of them. We called every single public high school and every single private high school. And we asked them if they had an athletic trainer. Yes, there was about 50 people who worked on that for 2 years. Okay? So we didn't just try to pull out some percentage of them. We want to just know if they have an athletic trainer. If they didn't answer us the first time, we called them up to 4 times to see if they had an athletic trainer. So if they didn't have one, we asked them why they didn't, and it was a series of questions. And if they did, we wanted to get a sense of the extent of coverage. So I found extremely promising results from our particular study that 60 to 65% of all high schools in America have an athletic trainer there every day. Okay? All the practices, the games. That's really promising that we're moving forward. What was more promising? About 85 to 90% of all high school athletes in America have an athletic trainer that they work with on a daily basis. The reason is the larger schools were much more likely to have an athletic trainer. So the percentage of athletes who are covered is actually overwhelmingly, in a positive light. So if we're looking to make positive changes, we got to get with the athletic trainer because they're reaching, think of that, 90% of the kids that are in our country right now. That's a pretty positive thing in terms of trying to make some of those particular changes. But as you can imagine, athletic trainers come with a budgetary cost. So another thing that we're extremely interested in right now where I work is we're looking to see, is it actually cheaper to have an athletic trainer than not having one? People cut it because of budget cuts. But some of our initial work right now with insurance companies and liability and medical insurance companies is that we've had some recent conversations in the last couple months that have been extremely intriguing to us, that the insurance premiums skyrocket when they don't have an athletic trainer. And in one instance that we just found out, it skyrocketed above the salary of the athletic trainer. So they cut the athletic trainer, no coverage for the whole year, but they paid the price and they didn't have the employee there. Okay? So we're trying to find the angles to get people to understand the value of having the athletic trainer there, because ultimately that's, I think, our greatest service we could ever do in these particular circumstances.